Okay, well, I'll start by introducing myself then. We all know each other, but my name is Dr. Kate Shakespeare. I'm a clinical psychologist working in North Wales in the Ysbyty Conclwyd Renal Centre, and you should have seen my little intro video last week. So that's who I am.
I'm Dr. Nicola Parrish. I'm a clinical psychologist working in paediatric renal in the Children's Kidney Centre in Noah's Ark Hospital in Cardiff, and my post is funded by Kidney Wales.
And I'm Rebecca Chan. I'm a trainee clinical psychologist and I'm working in the Renal Psychology service in Glenclwyd.
So we were asked to do this video, weren't we, by Kidney Wales as part of the Kidney Wales Wellness Advent Calendar for December. And I think what Kidney Wales was thinking, and Brett in particular, was that this is a really difficult time for lots of people at the moment, and that Christmas isn't always an easy time for lots of us, and that it might be even harder this year because of what's been going on throughout the year. And what we wanted to do was to ask the community first about what is worrying them over Christmas and about the Christmas period, but also to get our heads together because we work, Nicole you work in children's services, I work in adult services, Rebecca, you're on placement in adult services, to have a think about how, as psychologists working in the renal community across Wales, we can get our heads together thinking about what the evidence base tells us about how people experience Christmas, how people with long-term health conditions experience Christmas, and then what evidence-based strategies or practices are known to be helpful when we stress, when we do feel very isolated and lonely, and we don't for a second think that what we're suggesting or what we're talking about is going to work for everybody. This is not a one size fits all. Some of this stuff might not apply at all, and some of it you might have heard already, and some might be new and maybe an opportunity to try.
Yes. And all three of us are taking a slightly different angle, aren't we? So, as I've explained, I'm working in child services. So I will be thinking about well-being and loneliness from a child and young person's perspective, or perhaps a parent's. Rebecca, you're thinking from a carer's point of view, aren't you? And Kate, from an adult, potentially an adult renal patient point of view.
Okay, so we've had a bit of a conversation already about what are the themes that's come up for us and the research that we've done, and I think in line with what Brett from Kidney Wales was talking about is that it's actually really normal to feel isolated or be lonely at Christmas, and we know that for lots of people, whether they've got a long-term health condition or not, Christmas is a time of grief or remembering people that have been lost and aren't with us anymore, or feeling lonely or sad. We know that there are campaigns to try and reduce this people feeling lonely over Christmas time, and that the government, Welsh government and British government, recognise that this is a particularly difficult time for lots of people. And so although we might be thinking about things that might be making us feel like this time of year is more challenging, that we felt it was quite important, I think, that we acknowledge that this is actually a really difficult time normally.
Yes, and yet that's very different from what society tells us, where there's this pressure that Christmas is joyous and full of family and fun, and that there is a pressure for everyone to have a perfect Christmas and for everyone to really enjoy the season. Whereas that's not necessarily, like you say, how people normally experience it, but also with the added complications of COVID and the added complications of having a long-term health condition, it'll feel really different this year again.
So because we're scientists and we like evidence, we've all had a look at evidence from our perspectives, but one of the things that Welsh Government has done that's really helpful is it's done an audit of wellbeing across Wales a couple of times throughout COVID and throughout this year. And it's a snapshot really of how Wales is doing, how the population as a whole is doing. And from our perspective as psychologists, it's really helpful because it tells us that generally the people who responded to this audit are feeling sadder than normal, they're not feeling as buoyant as normal, they're experiencing a reduction in their well-being generally. And while we think, well, that makes sense, it's been a really hard year, it's helpful to know that actually the isolated people are feeling like life is a bit harder. I suppose one of the most striking things was that young people in particular are feeling, they've got the highest rate of distress across the UK, across Wales at the moment, which I think I just hadn't really considered, I suppose.
And a lot of the young people that I work with are really experiencing all of their day-to-day life and things that they were looking forward to and plans being taken away, so not being able to go out and socialise with their friends.
What we thought about doing today is, first of all, the most important thing is to normalise that it's absolutely okay to be feeling really stressed about Christmas and feeling really unsure and uncertain, and also feeling like it's just going to be a bit of a naff Christmas. That's absolutely fine that that is your experience. And I think we probably are getting those messages already, but I think we feel like it's really important to emphasize that. And then to think about more specific things that might help us around Christmas, and then answering some of the questions that some of you guys have kindly put forward for us, which have been really, really good questions actually. So who wants to start? What do we want to start with?
So when I was thinking about my 3 top tips, it was actually quite hard to get it down to just 3. But I think the first step is a bit like you were mentioning, Kate. It's okay to feel sad, it's okay to feel lonely, it's okay to feel frustrated. And quite often when someone else in our life is experiencing something like that, be it a child, a young person, or a family member, we often want to say, oh, don't worry, it's okay, it's not that bad, don't be silly, don't cry. And sometimes those messages can actually not be as helpful as we want them to be. And actually taking a step away from trying to stop someone feeling distress and understand exactly how they're feeling and why they're feeling that way is a really important thing to do. But it's also positive for us to do ourselves as adults. So often we might tell ourselves, oh, I shouldn't be feeling like this, or there's people in worse situations, I'm being silly. And actually thinking about, yeah, that is really tough and that is really hard and it will be different this year and that sucks. And so thinking about how we first of all respond to those feelings, but then realizing that we also don't need to get stuck in them. So sometimes we can go too overly, yes, it is sad, yes, it is awful, and get ourselves a little bit stuck. So knowing that we can acknowledge an emotion, even understanding what it is can be hard. Sometimes we can lash out and be angry at someone. Turns out it's because we're feeling really sad. So the first thing is understanding how you're feeling or how the other person is feeling and why that might be. And then finding a way to not get stuck in that. So realizing if you are feeling sad, finding activities that bring you joy. If you are feeling lonely, finding activities that bring you connection. And as much as you can plan for this, the better. So thinking beforehand, what are the activities that make you feel good? So Sheffield NHS Trust talk about green activities, red activities, and gold activities. So green is what is tried and tested in your life. What makes you feel good? What makes the people around you feel good? Is it things like getting enough sleep, sticking to a routine, talking to others, and thinking about doing those green activities every day? Red activities are those that don't make you feel good, so things to stop or avoid doing, perhaps drinking or smoking if you're an adult, or locking yourself away when you feel isolated, which is normal and a natural consequence but can increase that. So thinking about what things are to avoid, those red activities. And then the gold activities are thinking of this as a unique year, as a unique experience. And actually there will be things we can try that are a bit different this year than other years. So things like doing something completely different. So maybe having a curry for Christmas Day this year instead of your usual roast dinner, or connecting with family in a different way. So setting up the laptop when you're around the table and eating 2 different meals from separate households.
And I remember you saying, Nicole, about journaling, so capturing the fact that this is an unusual year, either if you like to write a written journal or are doing a video journal of what Christmas Day is like this year as a family, or if you're you know, children family, spouse family, pet family, how you're spending Christmas that might be a bit unusual this year.
Yes, definitely. So journaling really helps with well-being generally. As I said, getting in touch with yourself, getting in, understanding how you're feeling and why that is, and writing it out can be so cathartic. But also this year more than ever, it will be a unique experience. We will be missing things that other years we've completely taken for granted. And we'll be looking back at this year in decades to come of, oh gosh, remember that COVID year? That was really quite different. So having some way, like you say, writing a diary or doing video snapshots of acknowledging this is different and understanding how it's different and how you're feeling at different times, I think would be a really positive thing to do this year, both in the here and now and to look back on in the future.
Yeah.
The other top tip I had was to think about social media and to think about your social media use. So it can both be a very protective factor and a real negative one. So who are you following that brings you joy? Who are you following that makes you feel connected and makes you feel worthwhile? And who are the other people that you're following that perhaps make you feel more isolated, that question your self-worth and whether you're good enough? Who makes you feel more negative? And going through everyone that you're following and do a bit of a Christmas cull. Get rid of those that are having a negative impact on your mood and keeping those and perhaps increasing those that are making you feel good.
Yeah, and that feels really relevant across the lifespan, doesn't it? I think more of us are drawn to social media now more than ever, perhaps to have that connection, but also catching when that can feel quite toxic without us realizing. And I guess even if people feel like they don't want to unfollow cull someone fully, they might just be able to knock off their notifications just for the Christmas period, just to have a bit of breathing space from things that aren't as helpful over Christmas. Yeah. It kind of makes me feel like I want to do a lot of your top tips anyway, and that they might be more fun to do with kiddies. I don't know if my cat would be that interested in doing them. But, and what about you, Rebecca? So you've been looking at I guess from a spouse or carer perspective, and we know that an awful lot of the people in our community are either parents caring for a child with a long-term health condition, or spouses, or informal carers and formal carers caring for people they care about and love, and they might also be people with kidney disease also caring as well for other people.
Yeah. I think from a carer's perspective or a family member's perspective, when you're supporting someone that you care about, it can be really easy to neglect your own needs. You've got this sense of obligation towards them and a sense of responsibility. And also there might be lots of unhelpful thoughts or beliefs that you have about, oh, if I take a break for myself, then I'm being selfish or lazy, and that I haven't got time to look after myself. But I think it's really important to remember that actually the more you look after your own needs, the better position you'll be in to look after someone else. So I think one of my top tips for family members and carers is to take that extra break for yourself. Make sure that you make time to look after your self-care needs. Remember that we're not aiming to be superheroes here. You don't have to be perfect. You're just human, and to remind yourself that, you know what, you're doing the best you can with the resources that you have right now, and just take it step by step, day by day, because there's so much uncertainty around at the moment. We can't predict what's going to happen in the future, and we can very easily find ourselves on like autopilot. So we just get into a frame of thinking really negatively and worrying about what's going to happen in the future. With so much uncertainty out there, what can be really helpful is actually just focusing on the things that we do have control over and things that we can change. So little things can make a big difference. So things like taking a 5-minute breather and just really focusing on our own breathing slowly, absorbing ourselves in an activity that is nurturing or that we really enjoy. And if you can, try and get out for a walk, because we know that exercise is really good for us. if you can't get out for a walk, try and bring nature indoors, because we know that connecting with green spaces and nature is good for our well-being. So, bring plants into the home. See if you can tune into different nature documentaries, or some zoos will actually have live webcams where you can watch them feeding animals. So things like that, where you're connecting with nature.
Brilliant. And, I'm thinking about my top tips, and I'm going to be really succinct because you guys have kind of covered a lot of it already. But I suppose the first one is taking time out. So if you're in the middle of cooking dinner, or the kids are running around, or actually you're having back-to-back Zoom calls, or whatever it might be, is give yourself 5 minutes to just have a breather, check in, like Nicole talked about, with how am I feeling right now? Am I okay? What might I need to feel comforted? And it's absolutely fine not to be perfect, and for Christmas not to be perfect, because honestly, it bloody well isn't. It's not going to be, is it? It's, none of us want this in the same way. So perfect might be an unhelpful goal to reach for this year, probably most years. And maybe that's why people do get so distressed over Christmas, because we put just this big sort of thing about how Christmas should be. And if we don't reach that, what does that say about us? So what you said, Rebecca, about just doing the best job you can is absolutely good enough. And then, so I live in the mountains in North Wales, so it would be remiss of me not to say get outside and get some fresh air. And that doesn't have to be hiking up a Wyddfa Snowdon that I can see from I'm lucky enough to see that from well, I can't today, it's chucking it down, but my window. That can be sitting in the garden if you have a garden, or opening the window is enough. So the evidence tells us that getting fresh air is enough to reduce our stress hormones and to give us a lift. And if we're lucky, we might see a robin getting all cross in the garden, or we might see a bird, or we might hear the birds or hear nature. And even just feeling the rain on our hands, if we can get our hands out of the window. These things can be really powerful and potent, even though they feel like little things. Okay, so we had some questions, and Rebecca, you've got the questions, I think. Do you want to read them out and then we can answer them?
Yeah. So one of the questions that we had was about what do you do when you're looking after somebody and they're expressing suicidal thoughts about, oh, if I get the virus, I don't want to go on, I don't want to live. And how do you cope with that? What do you do?
That's a really good question, and that's a really, really difficult thing to be with, isn't it? If you're feeling responsible for someone's well-being and they're feeling like they don't want to carry on. And we know that a lot of people over Christmas do feel like they can't carry on. Sometimes it's because the living situation they're in just feels overwhelming and they want to escape. And sometimes it's because of other reasons. So like we said at the beginning, this isn't a one-size-fits-all, and this is a guide. So we've put together a little list of things that might be helpful when you might be feeling unsafe, or when you're living with somebody or a family member that doesn't feel safe, or that they might be in crisis. So the first thing is, if it's in the daytime, phone the GP. So phone your GP and let somebody know that you might be feeling overwhelmed, or that you're living with someone that does. If it's not in GP hours, 999 is your best option. Other than that, we've got helplines and text lines for older adults, adults and young people that we will post underneath this talk. So there's Welsh specific ones, there's Welsh language ones, and there's national helplines as well. So lots of options for making contact with someone that can help somebody to feel connected and safe. The other thing, I suppose, would be, we talked about just making contact with somebody in your life. And particularly if you anticipate that you might feel this way, or that this is a particularly tricky time, and connecting, like we've said already, with someone that helps you to feel safe and cared for. And if you're already cared for under the mental health team, use your mental health team, contact them and tell them that you're not feeling okay, or that you're worried about somebody. I've jabbered on. Is there anything else that you guys want to add?
I think that was very well put, actually. The only thing I was thinking is, from the person's point of view who's worried about someone, don't be scared to have conversations. Don't be scared to talk about things. You're not going to make things worse. You're not going to put ideas in someone's head. It can be really hard to have conversations, but sometimes, a lot of the time, people need to express how they're feeling. So try not to shut it down, and accept it, and make a plan together about what's going to be best going forward.
Yeah, there can be nothing more lonely, is there, that we don't feel like we can say how we feel. And that's a really important point, Nicole, that letting someone talk about how they're feeling doesn't make those feelings worse. Often it can often make people feel better, even though we might be frightened that if we let people say stuff, it will make things worse. Do we have any more questions, Rebecca?
Yeah, so another question that we had was over the Christmas period, you might have had Zoom calls, you might have kept in touch with people, but what do you do after all the Zoom calls are over and you find that actually you're alone, realizing that you are alone? What do you do about that?
I think that's a really interesting question, and very relevant. I think, first of all, acknowledging that Zoom calls themselves might be exhausting. Social situations can be exhausting anyway, but doing it online is a very new and different experience, so it might be even more tiring. So you might feel emotionally exhausted, but you might also feel more lonely and isolated when you've been surrounded by people and then that's gone. I think something that can be helpful is planning, preparation. So having things that you're going to enjoy after it. So perhaps planning to take a bubble bath, or planning to take a walk, or sit down with a hot cup of hot chocolate or something like that. And knowing when in the day or over the Christmas period you might struggle a little bit, and intentionally plan some things in. So like we were saying earlier, think of your green activities, what can you do every day, but your gold activities, what's different and unique that you can do this year. So it might be doing some craft or some painting. Have a little think yourself about what helps you feel good, and intentionally plan them for times when you may struggle.
And we talked before, didn't we, about sticking them on the fridge. So make your list before you need it. We know that when we get stressed and distressed, our brains don't work properly and we can't think straight. That's a really normal thing to happen. So to expect yourself to be able to problem solve when you're feeling distressed is, again, that sort of a high expectation that, I wouldn't be able to do that. I'm sure, well, none of us can. So have it on your fridge, a feel-good list or whatever it might be, things that make me feel connected or cared for or soothed or just good, and work through the list. Don't think about it, just go for it. And do the same with your kids as well if they've got activities that I'm in Nicole's territory now, but they like to do that help them to feel soothed and cared for.
They might feel small and they might feel silly, but what we know is doing it, even going through the motions and doing these things, can help.
And if nothing else, it's a distraction, isn't it? Okay, so the final thing, and I don't think we've actually talked about this, that there's a clinical psychologist attached to every single renal unit in Wales. And although we're not a crisis service, so I'll be taking 2 weeks off over Christmas. And if you ever want to talk about this stuff, you can ask to speak to your clinical psychologist in your renal unit, and that's completely appropriate. We know that people with long-term health conditions feel more isolated, do struggle more, and that's why we're there. That's the point of us being there. So if you do want to speak to one of us, you can ask your renal team to do a referral to us. And especially that might be easier if you've never met one of us, or you can just get in contact directly with us. That's okay too. I realised we hadn't actually said that.
And again, for children and young people or parents, I cover the majority of Wales. So if you are accessing the renal team in the Children's Hospital in Noah's Ark, then speak to the renal team. North Wales can access psychology support through Alderhay in Liverpool. So again, speak to your renal team there.
Yeah, and actually, if you don't want renal specific psychology, there is paediatric psychology available in all the children's units in North Wales as well. So for parents and young people, so you might not have to go so far, but if you've got a connection with Alder Hey, then use what you know. Okay, we don't want people's ears to bleed, but is there anything else we want to talk about before we finish?
I think just really wishing people good luck over the festive season and best wishes. It's a little bit like brace yourself. It could well be a tough one, but it is just a season. Christmas is just a day, and things will be different on the other side.
Mm-hmm. What about you, Rebecca?
I think I would just say that, with all the uncertainty that's going on, and the regulations and the restrictions are constantly changing, so it's really hard to make long-term plans and predict things. But I would say that even though it can feel like a step back sometimes when we go back into lockdown or we add another restriction, just to remember that actually we're in a very different time and place now, where we know a lot more about this virus now. There's a vaccine on the way, and we've all managed to get through that first lockdown, and just to remember that you coped last time, and to fall back on the strategies that helped the first time round. We all learned things and managed to somehow plow through, so fall back on those and just acknowledge that you're more resilient than you probably feel.
Nice, yeah. And just from me, Nadolig llawen a blwyddyn newydd dda, Merry Christmas and Happy New Year to everybody across Wales, and we hope that this is received the way it's intended. And if you want to ask us any more questions, you can just pop it in the comments below and one of us will get back to you.